thyroidectomy is the surgical removal of all or part of the thyroid gland. It's done to treat hyperthyroidism, a goiter that causes respiratory obstruction, or thyroid cancer. To prepare your patient for surgery, make sure they're following their prescribed preoperative drug regimen, which will ensure that the thyroid is normally functioning to prevent thyrotoxicity during surgery. Expect them to receive iodine for 10 to 14 days pre-op to reduce the gland's vascularity and thus prevent excess bleeding. They may also be taking propranolol to reduce excess sympathetic effects. Notify the physician if the patient has not followed the drug regimen. Educate your patient on what the procedure entails, including removing the diseased thyroid tissue or, if necessary, the whole gland. Tell them that there will be an incision in the neck and a drain and dressing will be in place after surgery. Tell them that they may experience some hoarseness and a sore throat from intubation and anesthesia, and that they will receive analgesics to relieve discomfort. After surgery, watch for signs of respiratory distress. This is a priority because of how close the thyroid gland is to the airway. Keep a tracheostomy tray at the patient's bedside for 24 hours post-op and be prepared to assist with an emergency tracheostomy if necessary. Assess for signs of hemorrhage. Some drainage immediately post-op is normal, but there should only be a scant amount after the first 24 hours. Be sure to check the back of the neck where drainage usually flows. Ask the patient to speak when they wake up from anesthesia to check for laryngeal nerve damage. These are the parathyroid glands. They can sometimes be damaged in surgery. To assess for this, assess for signs of hypocalcemia. You can do this by using Schvotek's sign and Trousseau sign. Keep the patient in a high semifowler's position to promote venous return from head and neck and decrease oozing from the incision. Administer analgesic for sore neck and throat. For home care instructions, explain the importance of taking prescribed hormone replacement, such as levothyroxine. Teach them to recognize and report the signs and symptoms of hyper and hypothyroidism.
We interrupt this video to remind you of the signs and symptoms of hyper and hypothyroidism.
So when thinking of the signs and symptoms of hypothyroidism, I think of Eeyore, because some of the main symptoms are depression and slow speech, which I associate with Eeyore. Another symptom is weight gain, and Eeyore's a bit on the bigger side. There's also dry and sparse hair, constipation, and decreased libido. Hypothyroidism also causes cold intolerance, so you can imagine him shivering here. When thinking of hyperthyroidism, I think of Tigger, because some of the main symptoms are tremors, which I picture him jumping up and down, also diaphoresis and heat intolerance, so he gets really hot really easily, and sweats. Irritability and nervousness are also symptoms. You'll also see diarrhea, palpitations, and weight loss despite increased appetite. So Tigger's pretty skinny, but you can picture him being hungry all the time.
Alright, let's get back to those home care instructions.
Also teach them to recognize and report the signs and symptoms of hypocalcemia. Tell them to keep the incision site clean and dry, and help the patient cope with concerns about appearance. Maybe suggest loosely buttoned collars or scarves that hide the incision until it heals. And with that, your patient should be ready to go home. Thanks for watching.